are you? Good. I'm Nurse Kay. It's nice to meet you. I see that you've been up from your coma for the past 24 hours, so we're all very excited about that. Your surgeon, the entire staff here, we are so happy to see how you've progressed, so that's very good. I'm here to give you a head-to-toe exam, but especially we're going to be focusing on your cranial nerves because when you're coming out of a coma, even though we did the initial tests and your brain function seems to be fine, sometimes certain qualities and neural pathways in your brain can go in and out of complete recovery just for a while. Okay, so this might be a little tedious, but it's very necessary. I'm going to ask you a few preliminary questions just to gauge your cognition, okay? At present. So can you verify your first and last name and date of birth? Excellent, very good. Okay, and what year is it? Okay, do you know the month? Very good, okay. And can you give me your parents' first and last names? Yes. Yes, excellent. Okay, and their birth dates? All right. Very good memory. Okay, and I'm just going to ask you some medical questions about your history. Do you have any history of blood disorders or lung disorders? No? Are you a smoker? No? Any history of hypertension? Okay. Any genetic diseases in your family? Okay, breast disorders? Colon disorders? Okay. All right, and what is your diet? Are you on any special diets, or do you eat pretty much everything from the food pyramid? Okay, so that's very healthy. Do you take any supplements on a daily basis? Okay. Any prescription medications? Okay. All right, excellent. So I'm going to put on some gloves and we're going to begin. If you feel any pain throughout the exam, please let me know. And just to gauge on a scale of 1 to 10, how would you rate your pain right now? Okay, so still. Okay, and then on a scale of 1 to 10, how bad is that migraine? Okay, so we're going to bring in some pain medication later, but for now, since the pain medication tends to make you drowsy, we need to wait until after the exam to do that, okay? Just because I need to gauge your full cognition. Thank you so much. Okay. All right. Okay. I'm going to start just by listening to your heart and lungs. So breathe normally for me if you could. Good. Yes, very good. No extraneous sounds. Your heartbeat sounds normal. Okay, I'm going to listen for murmurs on the bell side. Excellent. So I'm going to listen to your lungs now. Could you take a deep breath in for me and release? Good. Okay, again. Very good. Let's do the same thing on this side. Very, very good. Okay, so I'm pleased with that. I'm going to take your blood pressure next. Okay, we're going to go ahead and use this arm if that's okay. All right. Okay, very good. I'm going to give it a listen as well. So just relax. Make sure that your legs are uncrossed. Okay. All right, here we go. All right. Okay. Okay. All right, you are at 115 over 90, so it's a slightly high blood pressure. We're not in the danger zone, but we're just gonna keep monitoring that, okay? Okay, taking your temperature. Okay, you are at 99.1, so that's slightly elevated. Okay, so slightly elevated blood pressure and heart rate. Okay. Alright, great. Next I'm going to go ahead and examine your face. I'm going to do some facial palpations and also gauge the top of your head and look for signs of a concussion and make sure that your present concussion is healing normally. Okay. Okay. Alright, so just relax for me. I'm feeling just the back of your head. And I'm going to be going down the neck along the mastoid bone, so just don't be alarmed here if you feel my cold fingers on the back of your neck. Okay. Very good. I don't feel anything, and the bump on your head from the initial accident has decreased a lot, which we're very happy to see. Okay. Alright, I'm going to be feeling just the front of your face. I'm looking for signs of swelling, edema, or any abnormalities along your sinus cavities and your lymph nodes. So I'm going to be coming a little bit closer. Just relax. Okay. Okay. Now I'm going to be applying some pressure just here on the jawline. Let me know if you feel any pain. Okay. Good. And keep letting me know if you feel pain. Yes or no? Yes or no? Okay. I do see a bit of swelling underneath the eyes. So I'm going to take some measurements, okay? I see it visibly. So that could be a buildup of sodium or signs of hopefully not an infection or cold. So, but your temperature was a little bit elevated, so that could be the case. All right, so I'm just going to do some measurements and making some recordings of that. Okay. Okay, so just relax here. Okay. All right. Almost 4 inches on either side. So the lymph nodes on both sides of your jawline are completely symmetric and appropriately intact. I'm gonna measure the nose to the ear. Okay, that's 3 here. That's 3 here. That's good. 3 inches on each side. Now I'm just gonna go right underneath the eye. Just gonna be also applying the tape flush to the skin to see if, yes, you do have some swelling. And some swelling here. Okay. Okay, I'm just going to be lightly tapping. Do you feel pain there underneath the eye? Okay. Alright, so we're going to be on top of that. I'm going to be measuring just along the forehead as well. That's 3 inches. That's 4. Okay. Things that look pretty symmetric. Just gonna be doing just one right below the nose here. That's 3 inches. That's 3 centimeters at least. Okay. Very good. All right. Gonna do some percussions along the face. So. Okay. Your fluid reflexes sound normal, so that's a good sign. Okay, it's just underneath the eye that we're concerned with. Okay, just quickly brushing through your hair. Just along the hairline, we just want to make sure there are no infestations or signs of damage there. Just hold still for me. I'm just going to use this fine-tooth comb. It's just checking for lice or any kind of dandruff or things that could indicate that you are low on fluid. Okay, I'm not seeing any signs. Just gonna be coming up here and just getting a scraping sample of the skin along the hairline here. Okay, that's completely normal. So I think you're good in that department. Okay, so do you have any numbness or tingling in the face? Okay, that you've noticed. Great. I'm going to gauge that just to make sure. Okay. We really need to spend some time on this too, just to gauge your neurological functions, okay? So forgive me if this is tedious, but we're going to do a sharp or dull test. Do you feel this sensation? Good. Does that feel sharp or dull? It feels soft? Okay. Say dull whenever you feel this sensation, and then I'm going to give you a gentle poke with this, and say sharp whenever you feel that. All right. Close your eyes, and try not to fall asleep on me. Good. Yes. Yes. Good. Okay. Good. Yes. Okay. All right. I'm just going to hit you with this sharp tool now. Not hit you, poke you, apply some gentle pressure. Let me know if you feel it on your left or your right side, okay? Say left or right. Keep your eyes closed. Good. Good. Yes. Okay. Yes. All right, we're going to continue with the sharp and dull. Okay, so just say sharp or dull. Okay. Good. Good. Yes. Okay. So it seems like the sensations in the front of your face are completely intact. I'm going to go along the jawline here, okay? So say sharp or dull. Good. Yes. Good. I'm going to feel along the jawline too. I'm going to feel your lymph nodes here. So I'm just looking for any signs of swelling or protrusions, and I don't feel any protrusions. I'm going to check your preauricular and postauricular nodes right here, so you're going to feel the light pressing just in front of the ears and now behind the ears. All right, that's excellent. I'm going to check your sensations to temperature, but so far I'm not worried. Okay, so this is a miniature kind of heating tool. So I turned on the light and it's warming up right now. So when you feel it against your face, it's going to feel warm. It shouldn't feel hot. So let me know if it's too uncomfortable. This is going to feel cold. So do you feel this? Good. And then do you feel this? Is that warm to you? All right, good. So go ahead and say warm or cold. Close your eyes. Good. Yes. Perfect. Good. Good. Yes. Okay. Okay, I'm going to test the strength of your facial muscles next. So if you could raise your eyebrows for me as high as they can go. Okay, and then frown. Did you have any difficulty in doing that? Okay, it looked like it was a bit of a struggle. So go ahead and keep your eyebrows lowered and try to raise them in 3, 2, 1. Is that the most you could go? Okay, raise your eyebrows. Good, now try to lower them in 3, 2, 1. Okay. Okay, I understand. Okay, but we're going to continue just to see if it's just limited to your eyes or if your nose and your facial muscles along the jawline are affected, okay? But I wouldn't worry. This is normal for people coming out of a coma. It's to have, you already have the swelling of the eye, and now you're having some muscle mobility issues. Since the sharp and dull test was perfect, I'm not too worried about a neurological problem, but we're going to keep on top of that, okay? All right, so bear with me. I'm putting my fingers right on the bridge of your nose. Try to turn your head to your left, okay? 3, 2, 1. Very good. Okay, the other side. 3, 2, 1. Very good. Okay, now try to turn your chin to your chest very slowly. Don't effort yourself, so if it's hard, just do as much as you can. 3, 2, 1. Good. Very good. Now try to lift your head to the ceiling, okay? 3, 2, 1. Very, very good. Okay. So I'm going to be checking your eyes next and your vision. Do you wear contacts or glasses? Okay. All right, are they in now? Oh, good. The nurse put them in this morning. So you should be at your normal vision now. Have you had any blurry vision since you woke up yesterday? Okay. Any peripheral vision problems? All right, we're going to do a test. All right, and have you been having dry eyes? I'm not surprised. That's a side effect of the medication you're taking, and that will go away when you leave the hospital, but for now it's going to be a little bit dry. Okay. Okay. So I'm going to come closer just to look at your eyes. Okay, let's see. Okay, your pupils are round and reactive. I see no scarring. I see a little bit of redness and veinage here beneath the pupil, but that is a neurological effect of your impact crash. Okay, so that's completely normal for how you're doing. I'm going to look at the other eye. Sorry about this bright light. Okay. Excellent. Okay, I'm not too worried about that. All right. Now I'm going to do a field of vision test. Let me know when my fingers enter your field of vision, okay? Good. 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 Okay. And let me know which of my fingers are moving, my left or my right, or your left or your right. Let's do that. Good. Good. That's very good. Okay. All right, and do you see this light? Go ahead and follow it for me. Now I want you to keep your face completely straight and just follow the light with your eyes. Can you do that? Very good. Very good. Okay. Okay. Now ignore my fingers and keep following the light. Good. Good. Okay. So this is a Snellen chart. I'm going to hold it up for you. I want you to try to read this fourth row for me, starting with the O. Oh, see, that's good. Can you read it backwards? Good. And what about the second to last row? Very good. And can you read that one backwards? Okay. And I'm going to bring it a little bit closer. Can you read this last row? Okay. I'm going to bring it a little further away. Can you read it backwards? A little bit of a struggle. That's okay. I'm going to point to this color right here. What color is that? What color is this? Good. And do you see all these circles here? Good. How many circles do you see? I'll give you a moment to count. Yes, 9 circles. Now, is this number 9 larger or smaller than number 7? Good. And is number 5 larger or smaller than number 3? Very, very good. Just going to use this metric here just to look at, just looking at the size of your eyes. Okay. Okay, that's all normal. So, Okay. I'm going to check your ears right now. So I'm going to ask you if you could turn your head and face this way. Good. Okay. Your tympanic membrane is intact. I like the nice color. No scarring or scratching. I don't see any redness. Okay. Have you been having any problems with ear pain or hearing? Do you hear a clicking or buzzing sound that's not there ever? Okay. That's good. Go ahead and turn this way. I'm going to look inside this ear. I see a little scratch here, but it looks not fresh. So have you had any kind of ear damage before? Okay, so you went to a concert in 2006 that kind of got out of hand. Okay, all right. But your hearing is completely fine. You just have a little bitty scar. Good. All right, I'm just going to look in here. Okay, a little bit of wax buildup, but nothing that I'm worried about. Excellent. Okay. So I'm going to be using this tuning fork to make a sound. Do you hear that sound? Does it sound like a low or high pitched sound? All right. Did you hear it stop? All right. Now close your eyes and let me know when the sound stops. Okay. Good. Yes. Good. Yes. Great. Now, which sound is louder, position 1 or position 2? I'm going to give you 2 options, so say 1 or 2. 1 or 2. Good. 1 or 2. Yes. 1 or 2. About the same? Good. Very pleased with that. And this is a sort of vibrational tool, so I'm going to be resting on your chin and different sides, different quadrants of your skull. So you're going to feel a vibrational sound. Let me know when you stop feeling the sound. If you don't feel anything at all, let me know, because that would be very important to know. Okay, so close your eyes. Good. 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 Okay. I'm going to whisper some things in your ear. Okay. Happy Thanksgiving. There's a puppy on your bed. Cold weather. Sunshine. Snow. Sweep the floor. Wash the dishes. Trim the tree. Go to the bathroom. Sit down. Okay, good. Very good. I always have a little fun with that. But you repeated everything I said, so that's excellent. I'm going to go ahead and clear some of these tools off and continue the exam with taste and smell. I just want to ask you, have you in the past 24 hours been tasting anything funny in your mouth, like a metallic smell that shouldn't be there, or a sour smell or a sour taste? Been smelling anything? Okay, all right, but you haven't been on a regular food diet, so you haven't had the opportunity to taste a lot, so this is going to be important. We're going to see, just to make sure that you're all intact and good to go. Okay, so I'm going to give you this scent. Close your eyes and inhale. What does it smell like to you? Yes, it's cinnamon. Do you have any allergies? Okay, then we're going to go ahead and see. What does this taste like? Chocolate, excellent. And let me know what this tastes like. Tastes like birthday cake, yes. Very, very good. I'm pleased with that. So open your mouth for me. I just want to look inside real quick. Okay. All right, could you stick out your tongue as far as it can go? Okay, now move it from side to side. Okay, up and down. Okay, now say ah. Okay, healthy. Dark pink color to the gums. All right, no swelling here. Don't see any mouth sores. Your mouth looks to be in really good shape, okay, except your lips are a bit dry, so that is probably due to some dehydration, which would make sense with the swelling underneath the eyes, so sorry about that. Okay, I'm going to just be palpating your chest here. Do you feel any pain when I press down? Okay, how about now? How about now? Okay, I'm going to be taking my fingers, going from the sternum to both sides of your chest. Let me know if you feel it all the way or if there's a point where the feeling kind of cuts out and you feel numbness, okay? Good. Good. Okay, excellent. All right, so we're moving on to the abdominal exam. Do I have your permission to lift your blanket and lift your gown? Okay, I'm just going to be having access to the stomach to listen for sounds of fluid buildup, abnormal acidity levels. I'm going to be feeling your organs and palpating. Okay? Okay. I'm going to be going a little bit low around right here. Is that okay? I just need to feel your lymph nodes and your pelvic floor. Okay. All right, so just try to relax and let me know if you feel any pain, as always. Okay. So I'm just going to be palpating here. Okay. Feeling your liver and spleen feel normal. Okay, could you take a deep breath in? I'm having a hard time locating the. Okay, very healthy diaphragm. Very good. Okay. I'm gonna go a little bit lower, okay? This will be very brief. Okay. Non-palpable lymph nodes in the pelvis, so. Okay. Okay. Any pain? All right. Okay. I'm going to take a listen here. All right, so just breathe normally. Okay. I hear some rumbling. Are you hungry? Okay. That's a good sign. It's a sign that your stomach is awake. Good. All right, very good. Okay. So before I move on to your legs and feet, I'm going to do a warm or cold test on your stomach. Okay, so this will feel like a warm sensation. Do you feel it? And this will be cold. Let me know which one you feel. Good. Good. Mm-hmm. Yes. 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 Mm-hmm. I'm sorry if that's painful. Just a few more. I just need to judge the lower quadrants of your stomach alignment. Good. 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 Okay. Excellent. Okay. How are you feeling temperature-wise? Are you cold at all? Okay. And let me know if you ever get cold. I can bring in some extra blankets for you. Okay. So I'm going to go ahead and palpate your feet, maybe do some measurements, and your legs. Okay. But everything so far is pretty good. Okay. Now you do have your comfort animal that you ordered, your Shih Tzu, sitting on your legs right now. We don't want to disturb her and disturb the comfort animal process. So I'm going to go ahead and work around her. I'm just feeling right here. And if I feel anything abnormal, we'll definitely take her off the bed, but she seems to be doing a very good job now, so. Okay. Okay. I'm not feeling any asymmetry, but I'm going to do some measurements just to be sure, okay? I'm going to be doing some measurements to your comfort animal as well. Okay, just to make sure that she's not experiencing any edema or swelling. Very good. Okay. I'm going to be measuring her. Okay, she is only 14 inches long, and around the waist she is only 8 inches, so she's a tiny one. Okay. I don't see any signs of edema or swelling. I don't hear anything bad. All signs are good and healthy. Everything's good. I'm going to measure her little nose. This is very relevant. That's only a half an inch. So your comfort animal seems to be very healthy and good. No abnormal signs with her. So that's excellent. Okay, very good. A new practice that we've implemented in our hospital is wooden tapping therapy to simulate circulation. When you're laying for as long as you are, you can risk severe edema to the legs and blood clots, so we want to avoid that. It's very important. So I'm going to just be tapping lightly on your legs. Okay, very good. I'm going to be just gauging your feet and looking for capillary refill, and then we'll be done, okay? Any questions? Okay. Okay, I'm seeing a 2-second capillary refill, so that's good. Okay, and I'm going to look at the other toes and the other feet. Do you feel this on your left or your right foot? Okay, which toe? Good. 2-second refill, so your circulation seems to be very good and just normal. Okay, so is this sharp or dull? Good. Okay. All right, I'm going to judge your Babinski response. Good. Excellent, okay. Do your feet feel too cold right now? Do you need extra socks? Okay, I didn't see anything abnormal there, so I'm gonna go ahead and make some notes, and we're done with the exam. I'm very pleased with what I saw. We're gonna be on top of the swelling underneath your eye, as well as your blood pressure and temperature. It's a little high, but nothing that we're gonna be alarmed at now, since you did just wake up, like literally a day ago, so. Yeah, we're gonna be bringing in your first round of food. I bet you're grateful to hear that. Yeah, so, and we'll be bringing in some more pain medication, okay? It's gonna make you a bit drowsy, so hopefully you can drift off to a lovely sleep. Thank you so much for allowing me to do this exam. Okay? Just relax and enjoy the rest of your day, okay? Just don't think about anything stressful. Just close your eyes and sleep, okay? You have nothing to worry about. All right, bye.